Good morning. No surgery yet, but I'll be heading that way shortly. Where I have to go is London, Ontario, and it's a 2.5 hour drive away from where I live. So, did you know that 400,000 to 700,000 people in North America this year will undergo eye surgery? Amazing, isn't it? Eye surgery that requires face down recovery. So I was thinking, if this video reaches even 1% of that group, it would be worth it. When I researched how to do face down recovery, most of the advice came from the medical field, medical professionals. And I couldn't help wondering, have they actually experienced this? Have any of them ever been through eye surgery and the recovery process? I would sure like to know. Maybe I'll ask the doctors and nurses when I'm there today at the hospital. It's one thing to know what to do and to be told what to do, but living through it is completely different. So as I look at what's coming up, I am apprehensive because it's a new experience, and most of us will feel that way. We'll feel a little bit jittery, anxious maybe, when you're going into an experience that's new for you. So in this video, I'm calling it a series, I'm sharing my experience to encourage others. If you've been told that you need eye surgery and that there will be a 24/7 face-down recovery period after your eye surgery, it's not an option. It's where the healing happens. The surgeon goes in and he does what he needs to do surgically to help your eye repair. But afterwards, the recovery part is where the healing begins. So you have to be patient with yourself. Now, here's what I'm doing to recover eyesight, to encourage the healing, to stay comfortable, and keep life interesting during this challenging time. Here I have what I call my nighttime arrangement, 2 trifold mattresses on the floor with a face cradle, which comes from a massage table a friend so graciously loaned to me. And I have pillows on either side of me because women need to be propped up a little in the chest area to help it make it more comfortable. I tried it out because you really need to try these things out to find out if you need to make some adjustments. And I actually found myself, I drooled and my nose got really stuffy. So it's amazing how gravity helps so many of our body functions to work well and stay in balance. It's not natural to be in a horizontal position 24/7. But in recovery time, there are things that can be done to help pass the time and aid in the healing. Now, again, I was very fortunate. My daughter had a massage table, which I didn't even know that she had. Now, if you're experiencing or need eye recovery time, you can actually go and rent some of these units, unless you, like me, have friends who can loan them to you. So this massage table is going to be, I think, probably the one I used the most because it has the little shelf down in the bottom for putting my iPad on. And this would be my third position, which is being able to sit on the couch, for example, which would be my eating position. And then I can just rest, relax, and change the body because the body is not meant to be in one specific position all the time. So the post-op instructions suggest doing a series of leg and ankle exercises plus breathing, and all of that is designed to encourage your circulation because if your blood is not circulating really well through your system, you run the risk of developing clots, and that's something you definitely don't want. This picture illustrates my eating position, where I'm able to sit upright because you do need gravity to help food go down, and I'll be staying in that position probably for about 15-20 minutes afterwards to encourage the system to do what it's supposed to do. This is me practicing what it's going to be like in the car drive on the way home after surgery, because we're coming from London, Ontario, back to home, which is about 2 hours and a bit drive, and I'm going to have to be like this the whole time. Has to be face down. Okay, 15 minutes and I gotta get out of here and get on my way. But I hope that gives you a brief summary of what it's going to be like. And, you know, I've often thought, like, I'm on this side of wellness. We're on this side of feeling good and being okay. And then the reality is often a different thing. Hopefully it's good. Hopefully I've planned as well as I can. But, you know, there's always the unforeseen elements. And so this is just a record of what it's like for my surgery, my eye recovery time. And I hope that that documenting it in this short series, 7 days, would be an encouragement to anybody who knows that they have to have eye surgery. I've likened it to when you have to take your cat to the vet, and the cat, you're trying to get that cat in the cage, and the cat is just pressing against that, like, and you never knew that your cat had that many muscles and strength. But that's me. That's me today. Anyway, I'll keep you updated, and we'll see how it all goes. Bye.